nature independent of the statistics office, while other support for the support evaluation to get a more accurate big picture of economy. To listening the people opinion, people need public opinion of this issue. I have developed the social listening tool as a flow in the screen. The first, with data collection, the social listening tool is our product and self-plugged by me. We collect the data from the online, everything mentioned in the internet about the revised GDP in Vietnam, from the forum, from blog, from website, social network, Facebook, Twitter, etc. So that we can clarify from the data sources from 7 sources: the website, the personal post, the fan post, the group post, and comment from forum and from YouTube. So it can say that it's larger sources than Google search engine, because up to now Google search engine only searching on the website, and we just searching, we can get the information from the website by searching Google. And the time frame from we choose from the 16 August of 2019 is the first time the GSO along the project revised GDP, and to the 31 January of 2020, the 1 month after the public the result, to see how the public say mention about the GDP revision in Vietnam. After data collection, we have the own information from the internet. So from internet we use 3 techniques to data processing. The first, we use natural language processing, equal NLP, to clarify and the first step of clean data. So after that, we use machine learning, and we apply the machine learning and deep learning to separate all of mentioned to 3 categories. The first is positive sentiment. What is positive sentiment?
Can you please go to the sheet that you have? Because you are still left with the methodology sheet, so you should go to sheet number 6 or 7, I think.
Oh, I don't know why when it's that here not.
Just go to the sheet that you're talking about. Yeah.
Yeah. So I will don't use full screen. It's better for maybe I don't know why.
Yeah, you should click from current slide above.
From current slide, right?
Yeah, click that one.
Yeah.
You didn't click it. That's slideshow.
Really?
Just go ahead.
It's okay. Just go ahead.
Okay. So I apply the 3 techniques. The first is natural language processing to the first clean the data. So after we have a clean the data, the first step, we apply the technique for machine learning and deep learning to separate to categories the only mentioned we get from internet to the 3 categories. The first is positive sentiment. The positive sentiment is the content that mentioned the support for this issue. In this case, is the support for the revision GDP in Vietnam. The negative sentiment is content that mentioned opposing this issue, and the nature is content that mentioned not closely related to the research problem. And in other words, the natural sentiment we can consider to the noise, white noise. So we don't use the natural sentiment for the analysis. So from this flow, we have the getting data with collection, processing, analysis. After apply the 3 techniques, we go to analysis. The result from the getting data from social listening tool, we have the more than 1,000 mentioned about the GDP, revising GDP in Vietnam. And the number mentioned is changed by the month. From the chart, you can see that the first, the mention here, the most mentioned in the August of 2019, because it's the first time
We don't see that chart, Hung. You have to go to the result slide. We don't see that chart. Please go to slide 7.
Yeah. Oh,
do it manual.
I don't know why you're not training.
No, just do it manual when you go to the next slide. Okay. Go ahead.
Okay, so I this situation don't use the full screen. Sorry for. So this out. Now we have we collected more than 1,000 mentioned about the revising GDP in Vietnam. It's the number mentioned it change month by month. The first, the month we have the mentioned most in the August. The first time we did how long the plan to revising in Vietnam. So the revising GDP in Vietnam is a big problem with any country, especially in Vietnam. The first time we revise GDP, so that we concentrate and many people in Vietnam to mention to discussing about this problem, so that you can see the August and September people discussing so much in this issue, and it's down in the 10 and 11. In September and January of 2020, is that when zero launch the results, the people discussing the number of people discuss raising again. When it comes to the short mention, we have 7 sources of mention we collect. So in the website, the people are discussing the most with more than 20%, 70%, sorry. So after, and the next is the personal post with more than 14%. A personal post is most popular in the Facebook, the most popular social network in Vietnam. And this is all mentioned. It comes to the sentiment analysis. The sentiment analysis, we have the overall, we have the positive is always bigger than the negative. It means that most of people in Vietnam will support for this issue of zero. So, and it also change from the month to month, and you can see in the screen, always the positive, always the higher than the negative. And from the personal detail information from the subscriber, we can collect and have information about gender, a poster. You can see that the man is higher than the woman. Or maybe the men always concentrate on the macro problem than the woman, and it's quite different in the popular age range. The age range is from the 35 and 44 year people from this time age range have most concentrated in this problem. And then this gender distribution by age, it combines the age and gender. And also from the information from poster, we can have the location of poster in urban or rural, and people from urban is most concentrated for than the rural.
And can you finish in about 1 minute?
Yeah, 1 minute, yeah. And also education, you can see in the picture. Discussion and conclusion. And devising GDP is regular task of National Statistical Office, but this task can cause a public misunderstanding about the objectivity of the statistic data. To minimize the negative option that cause instability of social and reduce the trust of statistical product, and propaganda need to carry out through the official communication channel such as the regional website, mass media, and special need to focus on social network. The propagation and exchange idea also need to be carried out through a workshop, seminar at university research institution, because this place has a place for people who have deep expertise and have great influence in society. The active should be focused on taking place around the time of allowing or implication public the result. And from this case, we can see that social linked students have excellent advantage compared to convention survey, such as the number of operations is much greater, virus information, and net time and finally result to lead to convey the result. For better result, the algorithm we need to be constant upgrade to make the tool database more diverse and classify more accuracy. An educator that like the general sentiment of social needs to be thoughtful and calculate in the following study. It means that we now in the researching field we have the contour model to calculate this, and I hope that in the future we have apply the circle model to calculate this the general sentiment of society. Thank you.
Thank you very much, Hung. Thank you for this presentation. GDP is, of course, like census, one of the most sensitive data that we have. Gross domestic product causes, of course, a lot of sentiment with respect to people about the progress and about the developments in a country. Of course, we had the huge discussion about beyond GDP, but GDP, looking to the economic developments, is still considered to be one of the main indicators for wealth and for progress. Census has caused a lot of quality problems all over the world. GDP, of course, also. GDP with respect to going up or going down always causes troubles because it's very much linked to, for example, the stock exchange. It's linked to the value of the money. It's linked to your the people in the streets attitude to how to buy and how to sell. It's impacting the housing market. It has a lot of impact. So you can imagine that knowledge about how people think about GDP is quite important. So thank you very much for your presentation, Hung. And I would like you to start thinking about the question about how you can use what you have been making to make people more engaged in statistics. Because as I read your paper at the moment, it looks very much as if you are talking about the tool to collect information, but can you use your tools also to engage, to support, to inform the people that are using GDP? But think about it during the next presentation. Thank you very much. We go to the next presentation, which is a presentation by our guest from the Maldives. So Sephora. Sephora is at the moment Assistant Director for Health Information and Research in the Ministry of Health in the government of the Maldives. She was before a Technical Assistance Coordinator to Environmental Monitoring and Management and Community Development Specialist. Sephora is also a schooler from Adelaide. She has working on socio-economic developments for over 18 years, so quite a long line of experience. And she's going to inform us about the civil registration and vital statistics systems in the Maldives, which is, of course, looking to the current pandemic, the COVID-19 crisis, a very important piece of transformation. Because based on the mortality statistics, we of course can look into possibilities to monitor and even more to forecast how the development of the COVID pandemic will go. So, Sephora, I'm going to give you the floor for your presentation. Please, go ahead.
Thank you very much, Peter. I'm Sephora from Maldives, and I'll be talking about evaluation of civil registration and vital statistics in the Maldives, and it's a mortality-specific approach. And in my presentation, I will be covering the paper itself, introduction, methodology, evaluation, results, discussions, and I will end with some recommendations that I have highlighted in the paper. And yes, introduction, Maldives is a very small country. We have 1,200 islands, but only 187 islands are inhabited. And in the last census, we had around 350,000 people living in the Maldives, Maldivians living in Maldives. And this is where Maldives is. You know where India is, right? India and Sri Lanka, and there is the little small dots here, and this is Maldives. And when you expand, you will see Maldives like this. And each of these green dot is an island. And yes, the civil registration and vital statistics system was established as early as in 1960s in the Maldives. In 1960s, we started reporting births and deaths, just counting the numbers. But in 1990s, that is specifically in 1993, we enacted the law, civil registration and vital statistics law, where it enforced everybody to be buried before after having a death certificate, which is certified by a medical practitioner. And in 1999, we started a database with all this data that we have created along the way. And in 2000s, we had an online VRS module introduced to all the stakeholders where they were feeding data online. And in 2010, there was a national movement towards decentralization, with the death registration decentralized. It means they were decentralized to the islands and at atoll level. And in 2013, we had a dedicated staff allocated for the VRS, for statistical purposes, for reporting deaths, and for doing analysis on deaths. And in 2015, we had our VRS regulation, which to reduce discrepancies which were happening in the atolls, in the islands, and among stakeholders. And moving on, for this paper, the main information sources were, the first one we used the population estimates from the Global Burden of Disease Group studies, because when we use the Maldivian census studies, we get a very high life expectancy. And when we use the Global Burden of Disease Group studies, it's almost like in the mid-range, not very high, not very low. And in the last 4 or 5 years, nationally, we have been reporting the same life expectancy. So we thought like it's a different estimate that we would be using. And also we used in this study, we used ICD coded deaths from CRVS system for 10 years, that is from 2009 to 2018. The evaluation methods in this paper we are using ANACONDA, that is analysis of cause of national death for action. This is a tool released by University of Melbourne recently, and it has 10 steps to evaluate deaths and mortality registries in a country. We also did a business process method mapping to see what are the different gaps in the system and where we can actually improve. And I'm going to show you a little bit more on what ANACONDA does and what was used. ANACONDA actually calculates as the last step of it. It calculates vital statistical performance index. It has 5 components. One is the completeness of death registration. Second, amount and type of garbage codes used to record the cause of death, including non-ICD codes. And the third is the degree of cause-specific detail included in the input data. In our case, it's the mortality registry. And the fourth one is the frequency of biologically implausible cause of death in the data set. And the fifth one is the fraction of deaths which neither the age nor the death nor sex was recorded. And this is actually a snapshot from the ANACONDA, the screen you get at first. I just thought I will show you. This is a free tool that anybody can use. And our results shows that the VSPI or the Vital Statistical Performance Index in the Maldives has been varying between low and medium during this period, during the 10-year period. And for all the 5 components from 2009 to 2018, we have been performing pretty high, mostly in all the categories except for quality of cause of death reporting and the level of cause-specific detail available in the system. For all others, it's almost more than 95 or almost 100% complete. And our results also show that the quality is low due to the garbage codes. A lot of garbage codes reported in the system, and about 50% was observed to be the garbage codes which can be in the group 2. Group 2 is the non-communicable diseases, and from the CRVS system, we have more than 60% garbage codes. That means the ICD codes used are garbage codes which cannot be allocated to any of the groups mentioned above. And we did a business process mapping to see where we are lagging or what causes this kind of garbage codes or where are the quality gaps. The quality gaps actually happens because of the time lags, the bureaucratic process that we have. What happens in Maldives is when there is a death in an island, the death certificate is certified by the medical practitioner in the island. It is passed to the atoll hospital, and from the atoll hospital it comes to Male. Male is the central island, the capital island of Maldives, and in Male it is passed from one department to the other, and when it comes to Ministry of Health and when we do the coding, sometimes it takes more than 2 or 3 years to code it. So you know that the time lag between the time of onset of death and the time it's coded and entered, because of this time lag, the quality decreases. And the physical documentation for verification because of the geographic dispersion is low, and there is also a duplication of efforts. If you are able to see the paper, you can see in detail that the coding actually happens in the main referral hospital, the tertiary hospital, as well as it happens in the Ministry of Health. And there is the system that we are currently using is an outdated and incompatible software with the current technology. So it's difficult to upgrade the system to the current methods, and it's slow, and these things happen. So these are the main points that have been identified in the business processes. Yes, VSPI is low and in the medium, but compared to the regional countries, the Zero regional countries, Maldives still has the highest VSPI in the region. But the garbage codes are a main concern for us. The medical cause of death certification, the medical certification of cause of death assessment shows that we don't have mostly time intervals stated by the medical practitioners and physicians, and other guidelines of death certifications are also followed less by the physicians, and it's of low quality. And we have multiple stakeholders having a stake in the VRS system or the CRVS system. So therefore, it is a fragmented system where nobody takes the lead role, and it is a shared system. There is no specific agency to work on to improve the system. But but we are able to produce SDGs not in a very timely manner, but it's not like every 5 years. We are producing it every 2 years, and this is our last SDG that we produce. Most of the indicators of the SDGs, the denominator, as you all know, is the data we derive from the mortality statistics. And as recommendations, we are identifying we have to have annual assessments to monitor the vital statistics and understand the status of the current system. And we need feedback from all parties involved to improve and sustain this system. And the government, we need government commitment, investment to strengthen and integrate the CRV system with a real-time system. With the COVID, I just wanted to link it with the COVID. I know in the paper we haven't mentioned anything on COVID, but with the COVID, this has been in the forefront, and everybody is currently working on a real-time system because we want to monitor the different the COVID deaths in real time, and it is actually happening. I'm really happy to say at this moment that it is happening, and we are trying to roll out a system very soon with efforts from the government. And there is an opportunity for real-time mortality monitoring in the Maldives if each party of all these government agencies plays their roles in coordination, bringing new technology transfer to death certificates. And with the expanded use of technology in civil service institution, we have we have the possibility of having universal death certification in the Maldives. Thank you very much. Stay home, stay safe. And I just wanted to appreciate, appreciate and thank my colleague, my friend, my mentor, Dr. Sheena, for all the input she has given me. She is actually here with me listening to the presentation. She has been actually pushing me to do the presentation and, submitting the paper. Thank you very much.
Thank you very much, Sephora, for this excellent presentation. It's very nice to see those three topics, census, GDP, and COVID, in one session, as they are, I think, at the moment, currently, most important topics that we are talking about in statistics. And COVID-19 and all the statistics about it will be a topic that for the next years to come probably will be dominating our statistical work. We need a lot of information on the epidemiological issues linked to mortality, linked to all those specific health issues, but we also need a lot of information about socio-economic developments, as we all expect that the current years will be rather difficult with coming into a situation of a recession due to all the COVID-19 lockdowns. And I'm happy to see this presentation from Sephora. Sephora, before going into the question and answer session, looking to the questions from the others, I have a question for you about the constraints for the Maldives with respect to the quality of the mortality statistics. But thank you for all the three presenters at the moment. I think we now go into a question and answer round. Questions you can ask via the chat box, but I already had asked three questions, one for Vinida, one for Hung, and one for Sephora. So I'm asking Vinida now to answer her question, which was the question about the low quality of administrative data for marital status and education, and how could you increase quality of those data by using other administrative sources. Vinida, could you please answer to us?
Thank you, Peter. So thank you for the question. I will try to answer the question. So since Indonesia has a unique ID number for almost all, sorry, it's noisy over there. Can you mute it?
Yes, can all those who are not speaking please mute their phone? Mute the...
Sorry. Thank you. Thank you so much. So Indonesia has a unique ID number that used for almost all administrative purposes. So it can be used also for civil registration, for all administrative purposes, it's obligated to use this single ID. Become more and more institution use connected single ID. So looking for this fact, there is a possibility, of course, in the future to use other administrative sources such as civil registration, including vital registration and the record from Ministry of Education. So in this case, for the data from the Ministry of Home Affairs in Indonesia is still like stagnant. They are not updating their data for those, for example, those two variables that are relatively easy to change over the time. So we haven't assessed other data yet at this moment, but we are planning to use other data sources also to borrow the variables such as the marital status from vital registration and also maybe from the Ministry of Education for the record of the highest education attainment in the future. So we can have this more updated data in the registration. But for now, we haven't used or borrowed that data yet. Hopefully in the near future, we can start exploring and access the data. That's my answer, Peter.
Thank you very much. In the meantime, we have a second question for you, Winida. It's from Sheena from the Maldives, and Sheena is asking you, could you briefly describe the process Indonesia adopted to decide on which administrative data source used for the census? And Sheena is assuming that there are many administrative data, so she wants to hear a bit more precise why you decided on that specific administrative data source.
Thank you for Sina also for the question from Maldives. So it's about the process of adopting the administrative data sources, this one that we use now. Of course, there are many administrative data, but the data that we are using now is the core data. So the Ministry of Home Affairs have started to implement the single ID number since about 10 years ago. So everyone has only one unique ID number, and they are hosting for this implementation. In the beginning, it wasn't big enough, the number, and now, as I mentioned already in the presentation, it's already it's estimated about 97% of population has ID number. So from there, the data is then used to connect to other administrative purposes, since people have to use this unique ID number for other administrative purposes. So since the beginning, BPS Statistics Indonesia is already decided to use this database from the Ministry of Home Affairs. And however, we also think about other sources of administrative data to be borrowed in, and we can use it as a complementary data for other variables. However, since the legal process was very complex and took so much time and haven't finished yet until we start the census, it already starts since February this year. So we only use the data from the Ministry of Home Affairs as the basic data, and then we complement it with the data gathered from the enumeration process or the self-enumeration process. I hope that answers you. Yeah.
Yeah, sure. Thank you very much, Winida. Very, very good answer. I have a question for Sephora. Sephora has a question from Mrs. Blair from the Philippines. So, Sephora, can you share some of the initiatives implemented by Maldives government to increase the quality of the data on mortality? So, Sephora, please. Thanks, Winida.
Yes, we have certain measures. The first one is the death certificates can only be certified by a medical practitioner. That means minimum they should have an NBBS qualification, and they cannot be buried without the death certificate. Nobody in the Maldives can be buried without the death certificate. But our problem is our turnover is pretty high. So the doctors, we have a lot of foreign doctors working in the Maldives. So they come here, they work 2 or 3 years, and they go back. Most of the time when they come, even though they are MBBS, I mean, they have MBBS, they don't have specific knowledge on writing the death certificate. So we train them when they come. We train them on writing the MCCOD, medical cause of death certification, and at the moment we are going to have real-time data collection of death certificates. So when that happens, we will be able to give them feedback on what they have written. If columns are missing, if data is missing, we will be able to do it. And also we are having we are having MCCOD assessments on and off. So annually we will be having NCCOD assessments to see the quality of data that medical certificates have.
Thank you very much, Sephora. Can you also ask then the question that I raised to you, which was about the constraints to increase the quality of mortality statistics, which is more or less in the same line?
Yes, it's a similar. I mean, it's in the similar line. We have foreign doctors. We have to have MCCOD training. The turnover is really high. So these are the main constraints. I'm sure the geographical dispersion. All these days we were saying, okay, this is actually it is a constraint. Geographically dispersed islands, but the COVID itself has proven us that it being geographically dispersed is also positive. It actually gives us a containment measure. So we can't always say that geographical disbursement is negative. It's positive at the moment. So a geographical disbursement is a constraint, but we have digital connectivity now. So we are actually using the technology as to our advantage to tackle these constraints we have.
I think that's an interesting topic that you just discussed, because that is, in fact, the second question that I wanted to ask to you about the Maldives being so geographically dispersed. You're 187 islands, and I was wondering, how can you increase the quality? But I understand from your answer already that by going to new technologies,
Yes.
the registration can be improved. Is that correct?
Yes, exactly.
Okay.
And also we have online training. Now, I think yeah, we have advantages. We have explored advantages in this short period of COVID. Actually, I'm working in the COVID center, and COVID is always in my mind. So the online trainings, the real time talking with staff in the islands, real time, every day now. So those kind of things we are exploring now, and on this will be helping us to improve the quality. And to sustain after COVID also, we will be using these technologies and the platforms that we have established.
So it's quite interesting. If you read the articles in the June issue of the Statistical Journal, there are 4 articles on COVID. And one of them is by Len Cook. And Len Cook, maybe some of you still know him. He was the old Director General of Statistics in New Zealand. He was for many years the Director General of Statistics in the UK. Len wrote a very interesting article about how to improve the statistics on COVID in general, but he was also already looking forward to how new statistical systems could answer on the upcoming questions, and how statistics in general could also profit. It's a strange way of saying, but how statistics could profit from COVID, because by COVID, the registrations need to put into place much quicker and much more efficient than we have been doing before. So from that perspective, new developments can be used also then for other statistics. Thank you. I will go to some questions for Hung. Hung, there was one question which I was asking to you about the way you can use your tools, not to just collect information, but also to engage more the audience. Could you elaborate a bit more on that, Hung?
Yeah. Then from my view, and the advantage of my tool, I think that we can use this tool for support for the church of statistics. And for example, after in each data publication, publish the data from the general data, or after the result of any survey, we can use this tool to collect information about the audience from the public. To see how the public concerned in what aspect of the data. From this, we can have some paper, some posts, some article in website, official website, on social net channel to explain for the public to they will good understand how the statistical products. So that is good for the transparent of the statistical office. Yeah.
Thank you, thank you. Just for Aisha and the others, we probably have no time for a break, so we will go immediately after the next question to Hung. We will go into the presentation by Aisha, so you can already start preparing yourself. But Hung, a second question. If you think about the measurement in general, how to engage people, do you have a certain preference for a certain tool that gives you more possibilities to engage the people?
Yeah, I think when we for example, after we publish the data from the result result of the survey, we can explain. We can explain for any concern of the public for the data. Is one way to engage the people to concentrate and raising the trust of the trust of data in from the public. Because
okay.
we can know everything people thinking about our product.
Thank you. Thank you. I think with this we can close the. Oh, sorry, there's another question for you, Hung. Question is, how did you filter some of the biases from the public when revising the GDP? So this is a question from Mr. Salinas from the Philippines. So how did you filter some of the biases from the public when revising the GDP?
Yeah.
The question is really, when you start revising, how do you use the bias from the public?
The filter the bias from the public. This is one of the most problem when we apply the machine learning to separate to what is the positive sentiment, or is it positive or negative or neutral sentiment. So that this is one of the most take time so much in my collecting data and clean data. We need first we will use technique from natural language processing. After that we must build a training file. It means that the template file, template dictionary for what is positive and what is negative, for example. So after that we will use deep learning to predict the other mentioned.
Okay.
Yeah.
So it's maybe because I think your answer is only partially covering the question from Mr. Salinas. Maybe you can contact Mr. Salinas, Jan Blair P. Salinas in the Philippines, and discuss it bilateral with him.
Yeah.
Looking into the time, as I said, I decided to skip the break because the break will take us too much time, and we only have another 25 minutes to half an hour. So I'm looking now to Aisha Domnes. Aisha is working in FAO, the Food and Agricultural Organization of the United Nations, in Rome, in Italy. Aya is a statistician. Aya has a PhD in statistics and a master in economics. She is working already with more than 10 years of experience in research and practical experience. I think we have met a couple of weeks ago when we were in Rome, Aisha, so it's very interesting to see all the very relevant work that FAO is doing in the field of the SDGs, especially those which are related to food, agricultural, fishery. And it's interesting that FAO is more or less leading the international organizations, the custodians, in how to improve the measurement of the SDGs, and especially, of course, those which are under the custodianship of FAO in the world. Acha is going to tell us about the statistical capacity to monitor the FAO relevant SDG indicators. It is a worldwide exercise which has been done by FAO, and Acha will tell us more about the results for the Southeast Asian region. Acha, please go ahead.
Thank you, Peter. And thank you, organizers, for this great opportunity, first of all. And I can see also the audience. We are like around over 90 people in the room. I would like to thank also the audience for their interest for our work, basically. So yes, as Peter just mentioned, I'm here today to present you the results of the statistical capacity assessment that was conducted at FAO, and I will focus more on the results for the Asia Pacific region. And just to briefly inform you about our work, FAO is a custodian agency for 21 Sustainable Development Goal indicators and is responsible for, first of all, leading the methodological development and documentation of the indicators, promoting the adoption of internationally agreed statistical methods, and coordinating statistical capacity development initiatives in support of SDG monitoring and reporting. FAO is also responsible for overseeing the data collection from national statistical agencies and its aggregation and dissemination at regional and global levels. Actually, these are all contributing to monitor progress at global, regional, and national levels through SDG annual, global, or regional progress reports. And finally, FAO is participating in IAG, SDG, and UN Statistical Commission for this purpose as well. As I mentioned, FAO is custodian agency for 21 indicators, but in this presentation, in this paper, we focus more on the socioeconomic indicators, SDG indicators, where they are mainly distributed under Goal 2, Goal 5, Goal 6, water use efficiency, Goal 14, value added of sustainable fisheries, and finally Goal 12, global food losses. But you can find more details in our indicators that is listed, 21 indicators, through our FAO SDG portal. That's the link I shared here in my presentation, and I will try to share it also in the chat box. So the assessment itself was aiming actually to provide an insight about countries' statistical capacity to report and also to monitor on SDG indicators. And we are currently using this assessment to plan capacity development activities and improve the overall SDG reporting and monitoring process. But I would like to inform you that it is actually the preliminary screening process, because this is just to understand in which countries we have best practices and which countries we have some red flags going on. And this is used for actually more in-depth analysis afterwards. So again, it is for the preliminary screening. The target respondents for this questionnaire, for this assessment, was the national SDG coordinators or the SDG focal points nominated by the president of the NSOs in each country. And the questionnaire is organized in 5 main sections, where we ask questions on national coordination mechanisms, data availability for input data, for data sources, and the needs for technical assistance. And the questionnaire is available in 5 UN languages. As mentioned by Peter at the beginning, it is a worldwide assessment indeed, and we sent the questionnaire to UN member and observer countries, in total 195 countries, and 114 countries submitted back the questionnaire. In total, we have around 60% of response rate. But in Asia and Pacific, you can see the list of countries where we received the questionnaires back, in total 25 countries. And the results in this paper, in this presentation, are based on actually those questionnaires that we received from those 25 countries in Asia Pacific. So the first set of questions were, as I mentioned, on the national coordination for SDG monitoring and reporting. And we have seen a national committee actually responsible for the coordination of SDG indicators has been established around 70% of the countries in Asia Pacific. And more than that, a national coordinator for SDG monitoring has been nominated around 84% of the countries, which is a very high number, which is a good success story actually. And but when we focus on more on the indicator-specific national focal points, we have seen almost 1/3 of the countries has been identified, in almost 1/3 of the countries, no indicator-specific nation's focal point has been identified yet. I'm not going to go into the details of the results in details, but I would like to highlight 1 or 2 figures, but please refer to the paper for more detailed results. In these 2 figures, you can see first figure is on the current reporting rates, basically in national and international database by SDG indicators that I mentioned, socioeconomic ones. And you can see that it is for the most of the indicators, we can see that around 20% of countries are only reporting these indicators. But in the following figure, we can see requests for assistance for producing those indicators, and we see that there's a high interest in technical assistance from the countries, and hopefully this shows that in the future we will be able to. The countries will be able to produce more and more the data for those indicators when the assistance is supplied, basically. We asked also questions on the data sources, because we believe that national data collection status and future plans signal the limitations on data availability, enhance the constraints on the compilation of SDG indicators. But to sum up, for data sources, we have seen that majority of the countries do not regularly conduct some of the key data collection activities that provide main data sources for these FAO-relevant socioeconomic SDG indicators. When we concentrate on future planning even, we have seen that data collections which have not been carried out recently are not really fully planned to be carried out in the near future. So this is really a continuing constraint, let's say. And I mentioned about already on national coordination. But when it comes to the technical capacity, we have seen more than 50% of the countries will require some form of assistance to produce all SDG indicators under FAO custodianship relevant to economic aspect of the food and agriculture. So, I mean, overall, to sum up actually, high quality data and reliable statistics are, as we know, essential for measuring progress towards SDG targets, and enable national statistical systems to inform the design of evidence-based decision-making. And especially currently, following COVID-19 pandemic, now more than ever, investment in the immense power of data is needed to help drive the transformative changes advocated by the 2030 agenda. So from our perspective, some of the actions to be undertaken can be, first of all, ensuring that national or regional indicators are aligned with the global SDG indicators, first thing to consider. In addition, designing and implementing national statistical plans can be one other thing on the basis of the priorities. Improving the coordination among national producers is one other issue, especially for food and agriculture actually statistics we have seen through this questionnaire, since the NSOs are not always the main, main data suppliers. For instance, for Ministry of Agriculture statistics, there is a statistics division within the Ministry of Agriculture producing some of the relevant data. We have seen there is an issue sometimes in some countries coordinating between this Ministry of Agriculture, Ministry of Environment, NSOs. So we are really thinking improving coordination will help a lot. Finally, increasing investment by donors and national governments in SDG data production and use is required. And this will actually strengthen the capacity of this will help strengthening the capacity of national statistical systems and the technical skills of official statisticians. I would like to thank you at this point for this time, but I can tell you, as I said, please refer to the paper for more details, and you can find more. We produce country profiles based on this assessment, and they're all available in different languages through this link. And if your country results are not there, we can always communicate, and we can share the questionnaire with you with the National Statistical Offices, so that we can produce your profiles as well. Thank you very much.
Thank you very much, Aisha, for your excellent presentation. Very, very clear. My first question is a bit linked to my first remark, that this questionnaire was sent to 197 countries, and you had response about 118, I believe. How do the Southeast Asia countries relate to the rest of the world with respect to their preparedness for the SDGs?
As you can imagine, there are some discrepancies among regions, but there are also similarities. But when it comes to Asia Pacific, I can tell one thing to really highlight is the coordination aspect. A national coordinator, as I explained in my presentation, a national coordinator is assigned in most of the Asia Pacific countries, which is 84%, and it is actually above the global rate, which we found around 60%, 65%, sorry. So I can say one striking difference is, and good result from Asia Pacific is that. And another point that I can raise is actually linked to the type of assistance requested, which gives some signals about the preparedness of, let's say, the countries actually, or the region. And especially if we consider the type of assistance needs, for instance, in Africa, there is more interest in developing new surveys or data sources, and there is less interest in adapting existing surveys. While in Asia Pacific countries, the interest is more in adapting existing surveys, which is again showing somehow there is something already available, and we can maybe improve it. We can add some modules to collect relevant data, which is a good sign. Another difference I can highlight is Europe and Asia, for instance, are less interested in technical assistance for analysis or interpretation of indicators, lower than global results actually, which hopefully is a good indication again for having good capacity at that stage. After you have the data, there is enough technical skills in the institutions to read the data. The literacy of the data seems to be better, or we are hoping that it is indicating that basically. But I will always be careful about still comparing the regional differences, because I need to also highlight the fact that the response rate among different regions is also not the same. Unfortunately, in Asia Pacific, as I said, it's about 52%. While in Europe, for instance, we have 70% of the questionnaires submitted back. So we should consider also those aspects, I believe. Yeah, I mean, I can summarize maybe overall in that level, but I want to highlight one last thing and use this questionnaire for this purpose, if you will allow me.
Please go ahead.
Thank you. So one thing I need to highlight is actually these types of assessments are important from our side. And also, I think we should consider it like SDGs are important references at the end. That's why I'm telling these assessments are important. SDGs are very important references for development policies and programs at national level. And they help countries measure the progress they are making towards achieving objectives, learn from experiences, and understand which areas to prioritize and allocate resources to. And data is a key driver of transformation across all sectors. So for SDG indicators for which information is not available, monitoring at national, regional, and global levels will not be possible either. So this will eventually restrain the global community from taking informed investment decisions on these areas of development. So yeah, I think we should learn from these assessments, and we should invest more on how we can inform the nations, that the international community, to move ahead to improve in development targets, let's say. Thank you.
Thank you, Aisha. Just another invitation for the audience to put your question in the chat box. We still have around 10 minutes, so please do not hesitate to ask a question. In the meantime, Aisha, listening to you and listening to your presentation, one of the interesting things about quality is that we normally talk about quality and statistics for national statistical offices, talking about the mathematical quality, talking about conceptual quality, etc. But there's also, of course, quality in the sense that the data have to be compared between countries. And you are talking about the SDGs, and of course, at a certain moment, you will have SDG indicators which need to be, or which can be, compared between countries. Could you elaborate a bit more on the role that FAO wants to play in increasing that type of quality, of course, beyond capacity development? How does this work in your perspective?
Okay, thank you. So, first of all, in the quality aspect, as you can see, the questionnaire did not really aim to assess the quality of statistics, national statistical systems or output data, but we wanted to see how far the methods are adopted or standards implemented by countries to produce SDG indicators. So this assessment during the presentation, as I said, it's kind of set as a preliminary screening for us for identifying countries using the best practices and problems that countries facing to produce required data. A comprehensive quality assessment of the system actually is planned to be done through more in-depth assessments and by conducting missions to countries. So this preliminary assessment can actually help FAO to organize those missions. Why I'm mentioning about these missions, because actually what you said, the comparable data comes at that point for us. So FAO supports countries to strengthen their capacity to collect data and monitor SDG indicators. Well, through those missions, actually, what we do is we really have a more in-depth understanding which national indicators are really being used in the national, because sometimes even the titles are the same, as you can imagine. The name of the indicator is the same, but when we go into the details, through those missions, through those engagements, let's say, we understand. When we had the chance to check the methodology of the data, we understand actually the indicator is not really the same indicator as the SDG indicator. What we do is actually, first of all, to figure out those issues if there is really a discrepancy, and if we do it also through internally as well. We have some checks here as well when we receive data, when we ask data from countries. We have some automatized checks here, like checking previous data that was produced as an SDG indicator, if they're in line, with the submitted data, or some alternative data series we can use, right? For instance, food insecurity scale. For the food insecurity scale, it's highly correlated with poverty. If food insecurity is increasing, we don't expect, so we can always have the chance to compare two different data series and to understand if there is kind of a similar movement or not. So we have such type of, let's say, internal checks, or with the countries, we try to understand what is going on. And overall, we are really highly supporting, as I mentioned on my last slides, highly supporting the alignment of the national indicators with the SDG indicators. This is one of the main strategy actually we have, and we believe that it will be countries' gain basically to do that. One main thing I can say is for a country to be able to inform about their progress, comparable data is crucial. An ability to show donors or international community where a country is, if it's progressed faster or ranked lower, can be only extracted through comparable data. And it's important to have reliable, good quality, as we already highlighted with other presenters here, and comparable SDG data to increase mutual accountability and visibility in international forum, which will also help attract, financial support for development. And another point I can say is one other obvious benefit is to decrease actually the reporting burden rather than trying to report both SDG indicators and national indicators. I can say maybe in one stone, two birds, no? So, and finally, I can say if a country adopts all SDGs somehow or as much as they can, they will be able to receive technical support from custodian agencies like FAO, which could help improving their overall actual national statistical system. So there are also benefits out of it, I believe. Thank you.
Thank you very much, Aisha. Are there questions from the audience? I didn't see anything appearing on the chat box, but take your time to fill in a question if you have it. Please go ahead. In the meantime, or maybe someone wants to raise a question by the microphone. I don't hear a question. So we are 90 minutes through, so we are also approaching the end of our session. I just want to say a few words. I think we have seen a presentation on the census, on GDP, on COVID, on SDGs, and how could we be more relevant than covering those four elements. I think clearly that those four topics at the moment are so important to work at, and the link between COVID and GDP, the SDGs and COVID are mentioned in 2 or 3 of the presentations. So the SDGs to follow and to monitor the social and economic developments worldwide for the upcoming period are of utmost importance. It is very, very interesting topics that we have been discussing, and I just want to refer that a selection of the papers of the Asia Pacific Statistics Week will be chosen for the Statistical Journal of the EIOS. So I'm inviting everyone to think about that, and of course it will go via the organization of the Asia Pacific Week. The questions of the session will be recorded. The whole session is recorded. You can find it back on the link of the Asia Pacific Week later. I think I would like to invite all the presenters to come back to the screen. So Hung and Sephora, could you also please switch on your screen again? And maybe Eileen and Kai can also do that. So that makes it possible to give an applause to the presenters and applause to the organizers, just like. Thank you very much for the session. Thank you very much for the good presentation. And I wish you a very good rest of the Asia Pacific Week. And thank you very much. Eileen, you want to make a small remark?
Yes, so on behalf of the ESCAP, I would like to express our gratitude to Peter Everest for agreeing to chair these sessions. And I would like to also thank all the speakers of this presentation and all their co-authors who were not part of the presentation, but whom I know have invested a lot of their times to put in very good papers. And also the participants for hanging on until the end of the sessions. You have been very active, and we hope that this session we were able to get the knowledge that you are intending to have. And again, Peter, much thanks to you and Kai, who's I'm speaking on behalf of Kai as well. You have been very, very effective as session organizers, and thank you so much for allowing the ESCAP to partner with you and the SJIOS to make sure that we support young statisticians, aspiring writers of these regions to be part of that prestigious journal. Thank you, Peter, and thank you, everyone.
Thank you very much, and have a good afternoon. Bye-bye.
Thank you very much. Bye-bye.
Please don't forget to respond to the evaluation that we're going to have after this. Thank you.
Yeah. Thank you. Bye-bye.
Bye. Bye all. Thank you all.
Thank you very much. Thank you. Bye-bye.
Did you share the link? Again, I didn't see it.